Paul.
That's my cue. Hi, everybody. Thanks so much. Good afternoon. My name is Paula Aronson. Uh, I know most of you, but I am New Jersey's Ombudsman for individuals with intellectual or developmental disabilities and their families. And I am so glad to be here with all of you for this really, really important conversation. As many of you know, our office has worked with many of you, has worked with many others on issues concerning abuse and neglect of people with intellectual developmental disabilities. It unfortunately has been a focus of our work. But what you may not know is we work very closely with colleagues throughout government and throughout other organizations, principally the Council on Developmental Disabilities and the Family Support Planning Network Council. And we work very closely and we talk through these issues. And when the recent news series came out, Hidden at Home, that excellent news series, which I'm sure all of you have read through, excellent yet incredibly disturbing. Uh, the three of our organizations got together and thought, how can we sort of take this conversation forward? Now seems to be an opportunity, a real call to action, if you will. And so rather than the three organizations trying to decide sort of the best way forward for our whole disability community, we thought we would sort of engage and invite all of you stakeholders in the community to sort of be part of that conversation to help us to sort of, if you will, sort of find our way forward. So we view today's conversation as just the start, if you will. We're looking forward to hearing from many of you. For those of you who want to sort of share some ideas and thoughts after the meeting, by all means, please do so. But what we're going to do is take what we hear today, what we learn, and sort of come back to you at some point with some ideas about how we as a community, again, can find our way forward on these important issues. Before turning it over to Mercedes, I just want to acknowledge the folks that put the Hidden at Home series together, the folks at the USA Today Network, particularly up by my way, Bergen Record, but through the whole NorthJersey.com family. If you go to the stories, you'll see all the people that were behind this, but I particularly want to acknowledge Ashley, Jean, and Michael, who I think are joining us today to hear this conversation. They did a tremendous public service through their reporting, and I just want to thank them, and I think we're all very grateful to them. So I'm going to now turn off my microphone, listen, and turn this over to Mercedes.
Thank you, Paul. Um, Good afternoon, everyone. My name is Mercedes Witkowski. I'm the Executive Director at the New Jersey Council on Developmental Disabilities. I also have a 35-year-old daughter who lives at home, who accesses DDD services due to her disability. I want to welcome you and thank you for joining us today. The Council on Developmental Disabilities um, for those of you who are not aware, is established under a federal um, administration that uh, looks to our community and ensuring that people with disabilities and their families have a voice, have opportunity to contribute to the way the service system is structured, and look at ways that we can help individuals advocate, how we can help people with family members advocate, how we can advocate as a council, and in that advocacy, looking for systems change and how to build our capacity within New Jersey. Clearly, the 7,000 people roughly who reside in residential license settings are part of that community. There's about 30,000 people in the DD system, the adult system that also rely on services in general. There are children and youth throughout our state who rely on special education services, early intervention services. So our scope is pretty broad, but we are particularly focused today on the impact of individuals living in licensed settings. Those of you who are here as family members play a vital role. We also take note that many individuals living in licensed settings do not have families, do not have anyone to advocate for them, and that's also of concern and a highlight that we would like to address and focus on. Um, Unfortunately, this is not the first conversation on abuse, neglect, and issues that individuals have shared, not just in the Hidden at Home series, but in other multiple hearings in the legislature, um, outreach to councils, outreach to the administration, outreach to legislators. And I think we all wish it was the last conversation. And but to Paul's point, this is an opportunity to look at the system in terms of what's working, what's not working, and how we move forward in creating systems change that improves the lives of everyone, including those living in licensed setting. We don't do this alone. The Council on Developmental Disabilities does this in cooperation and partnership with, as Paul said, system leaders, the legislature, the administration, in a collaborative effort to bring about improvements in our system. And for now, I'm going to ask Carrie, who's helping us with our Zoom here, to just put up a slide to start our thoughts and add some highlights to the areas that we've seen and we have begun to, I'll call it, put it in buckets. This is because this is the beginning of the conversation. We want to make sure that we're capturing what we're listening to today in terms of items like provider oversight, management oversight at organizations and their training of managers, family and provider relations and communications, incident reporting and investigations, remote monitoring, medication administration, a couple of areas on direct support professionals, which include training and competency and recruitment and retention at provider agencies. And then, of course, state oversight, which includes licensing, unannounced visits. So we're going to add to this as we listen today, so that we can ultimately create this image, a visualization of the areas in which we hear about that are concerned and areas that we hear about that are working. So I'm going to stop there. I want to introduce now Dottie Blakesley, who's the chair of the New Jersey Regional Family Support Planning Council. Dottie.
Hi. Thank you, everyone, for joining us. The Regional Family Support Planning Council was created by law by the New Jersey legislature a number of years ago to exist as a continuing network of families. So we have 10 regions up and down the state. Every region meets monthly. Sometimes the meetings are virtual, sometimes they're in person, sometimes it's a combination of things. But we're there to continue this conversation, to educate, to advocate, to share concerns, to support each other. My daughter is 33. She's been living in a group home for 4 years. And sometimes it's been great. Sometimes it hasn't been great. But I have to say, for Maddie's specific situation, it's generally been okay. And I think there's a reason for that. One of the things that my daughter's agency does very well is they communicate. Anything that happens at the house, they know I'm the kind of parent who wants to know immediately. So if they see a bruise on her, they call their house manager, and that house manager gets on the phone with me within minutes. And they'll explain, they'll show me pictures and videos, but they're very aware that the best way to make this work is as a team. It's me, it's the agency, it's the day program, and Maddie in the middle. One of the things that happens all the time is Maddie is an epileptic. It's pretty severe, on top of her autism, on top of behaviors, but she has a lot of meds. Every once in a while, I will go to the house and I'll say, by the way, can I look at the MARS, the medical records, just to see that meds are on time. And they, without a second thought, not even checking with their supervisor, will pull out the book and show it to me. And I like that. That kind of open communication, I think, is something that all agencies should have. That is a best practice. That makes me feel that I have a little more confidence in what they can do. So I want to pass this back to Carrie, I think, to call up our first speaker.
Hi, everyone. Thank you for being here. I put the 5 first speakers already in the chat. So it's going to be Bonnie Bryan, Susan Colgettis, Jana Mermel, Parul Kemke, and Vincent Giardina. So if Bonnie wants to unmute.
Okay. Can everyone hear me?
Yes.
I tend to talk a little low, so just let me know if I'm not talking loud enough. I'll just jump right in. Our twin daughters, because I haven't met a lot of the people on the screen, so nice to see you. Our twin daughters, Allison and Rachel, were born 3 months early on October 21st of 1985. Rachel experienced more complications than her sister. She was a complex, nonverbal individual as a result of cerebral palsy, seizures, chronic episodes of constipation and dehydration. Aside from administering her medications primarily for drop seizures, her general care required diapering, bathing, assisting eating, etc. Daily monitoring of her medical and health needs, along with physical limitations and general care, was required throughout her life. We assisted her to live a full life in the community with assistance from DSPs in her home and local communities until age 13. As we approached our late 60s, the responsibilities of caring for Rachel became more demanding. We made a difficult decision to place Rachel in a DDD community provider residence. We didn't want to, but it really had become rather unsafe for us to handle her at home. In the first group home, there were 5 women, and the house was 1 hour from our home. Overall care was suboptimal, as Rachel experienced several medical complications while living in the residence. We offered to assist staff caring for her likes and dislikes, medical needs, how to dress her, etc. Unfortunately, the manager was not really open to having us participate with the residents. During one visit, I discovered Rachel could not use her right hand to pick up her glass. Staff were unaware, had not noticed that she could not use her hands. It took 2 months for her to regain her use of her arm and the care of a hand specialist. Additionally, an ongoing occurrence of diaper rash indicated she was not being appropriately cleaned. In fact, her primary doctor examining the rash stated, "This is the worst diaper rash I have ever seen," which she said in front of some of the staff. And I added to that when we returned to her home. Due to the poor oversight of the first group home in regards to health and safety, we secured a slot in a 2-person apartment 10 minutes from our home. The 2 roommates were very fond of each other. They were happy to move Rachel in closer. We were happy that she was going to be close to us and with a different provider that we thought had a good reputation. Staff were generally helpful and pleasant, but the manager was difficult. She insisted Rachel did not require a daily BM despite doctor's orders to do so, and that she absolutely needed that. Staff were required to provide water 24/7 for Rachel to also help her with her bowels, but they were not very good about giving her water either. In fact, there were numerous notations from OPI. Oh, let me step back. I'm sorry. Staff were, it was very clear that the manager was not following the protocol, as one of the doctors in the second hospital informed us that x-rays of Rachel's abdomen showed stool backed up below her right lung, causing pressure on her lung. In fact, there were numerous notations from OPIA regarding Rachel and serious multiple constipation episodes between August of 2019 and November of 2019. This is the period where Rachel became very ill, had to be hospitalized, and she passed. She was admitted to the hospital on October 22nd, the day after her 34th birthday, where we had had a nice birthday party at her apartment. And we moved her to another hospital that we felt was more appropriate. But unfortunately, she passed away due to constipation that went unreported in a timely manner by the manager and the staff nurse. As a result, serious complications developed, which she suffered terribly for 3 weeks, and it ultimately led to her death. That said, it was clear to us that provider staff lacked basic health oversight training, specifically the so-called Fatal Five. The Fatal Five are the most commonly identified causes of preventable death in people with IDD. We brought a number of Fatal Five posters for the staff of the provider that they were using, and I asked them to spread it out to other homes within their area, and I don't know if they ever even gave them to them, but I'm sorry, I get very nervous, so I really apologize. We brought under the manager's orders, Rachel experienced series of health concerns that went unreported to us for weeks prior to her hospitalization. And as a result, the lack of training and oversight led to a rapid deterioration of her health. Needless to say, the loss of our daughter has been and continues to be unbearable on a personal level, but it also highlights concerns that demand attention. Significant gaps within the statewide system at both the state and the provider level have resulted in countless unknown preventable illnesses, accidents, and even death. We need to protect these vulnerable individuals who require constant and consistent health oversight in a manner that alerts paid caregivers when medical attention outside the obvious physical injury is required. Subtle changes in behavior may indicate that a medical condition is developing or has worsened, and the need to identify what is happening is much needed by all of the staff at the home. A number of initiatives are under consideration. I think we just talked some of that, so I won't talk about that at this point. But as an advocate for this population for more than 35 years, which I continue to work on the Health and Safety Subcommittee, it consists of families and DDD, and I think, I don't know, we've tried for 35 years, at least I have, at least to move things forward, to get things moving, and everyone here has done the same, and it's really well past time for us to really push this forward. Thank you.
Thank you so much, Bonnie. The next person is Susan.
Thank you, Bonnie. Thank you for your courage and your perseverance and telling your story, even though it is excruciatingly painful. I appreciate that. My son, I don't know if you can hear him in the background, he's going upstairs, is Alex. He's 24 years old. And we knew before he turned 21 that we were going to have a problem transitioning to adult life. And we were in contact with DDD. So a big part of our story is that we knew it was coming. We knew we were going to have a problem. But the way that the policies and the way that the systems and the way that the rules are written for people who are medically complex with IDD just don't work. We have a current open Olmsted complaint. We've had Disability Rights New Jersey. We've had the Ombudsman's office working with us for years. No one is able to get this together in a way that will fix the problem ongoing and to prevent other people from suffering. And that is really where my concern lies. My son was in the hospital for 297 days, and we toured a group home, we toured a facility, and we toured a developmental center, and all were inadequate, frightening, disturbing, dirty, and we're not focused on the care of the people that was supposed to be the focus of what that place was about. And this is my concern, that if we know that my son is an NJ Cat F with acuity, not an E, an F, right? I want people to see what this looks like. It's a real thing. If we are saying that these are the people who need 24/7 care, are the most complex, require skilled nursing, but can never access CCP ever. And if you have an adult child who is in the system and becomes more disabled, ages and becomes sick and requires nursing, they have to give away CCP. They cannot access skilled nursing. So the places that we toured, the rate, so here's somebody who as a child was eligible for 16 hours a day of nursing. We didn't know we could get 24, so I never fought for it, but needs 24-hour care. In adult life, if we were to go into one of these places, instead of having one-to-one skilled nursing, the ratios were in the facility, it was 1 to 16. In the medical group home, it was 1 to 4, but the nurse was not on the premises. They were supervising 5 different homes in a city. And in the developmental center, it was unknown. So there's a lot of problems here. And there's a lot of ways that we need to address these problems. But I look at it simply from this place of how can we rewrite things to allow people to get to have their needs met the way that they need it, their unique needs met. So if you are medically complex, the only safe place for you is a hospital or in your home where your parents are providing the care along with those skilled nurses. And that's where we're at today. We had the one Sunday nurse call out yesterday, which meant that my husband and I did a 32-hour continuous stretch of care for somebody who has pneumonia. So this is my concern, for everyone to have that awareness, and I see the clock. Understand CCP does not include nursing. Understand that none of these places are the home of our people. That if their needs increase, that they will be escorted out, thrown out, and told to leave. And that we really need to press the people who write the policies to make these changes so that the needs of all the people, the unique needs, can be met in the way that is the safest way for them. Thank you.
Thank you so much, Susan. The next person on the list is Yana.
Thanks, Carrie. Thank you, Susan. And Bonnie, I'm really sorry for your loss. My name is Yana Mermel. I am a member of the council, and I am also a member of the National Council on Severe Autism Legislative Committee of the New Jersey chapter. But I'm joining today as a mom, just in a personal capacity. So take my comments as such. I want to quickly do away with the pleasantries, given the time constraint. Exceptionally thankful to Ashley and Jean. I believe we would not be having this conversation if not for their exposés. So truly thank you. Also, of course, thank you, Kyoko, Carrie, Mercedes, and Paul. Thanks for getting us all together. Um, I will also get away sort of upfront from saying that certainly there are good agencies and hardworking DSPs, but if this were the majority and the norm, we would not be having these conversations, right? So let's focus on where we need to roll up our sleeves and do some serious correcting. So I will also not delve into the extent of my daughter's story. She was abused and injured at the Special Children's Center in Lakewood, New Jersey. Um, Till this day, she lives with her lifelong injuries. She's missing teeth. At 22 years old, it is a crippling diagnosis. Her life quality is limiting. She cannot eat the foods that most of us on this call enjoy, and she has tremendous PTSD from the experience of being locked in her room, being starved, being over medicated, etc. The focus of my 3 minutes really will be spent on the response, or rather, as I like to call it, the non-response from the state, the advocacy entities, from the individuals whom families like ours truly relied on, right? Aside from Paul Aronson, there was literally no one who heard our story and even attempted to do anything. So I am sort of notorious for being very graphic. I would bring in images of my daughter being abused, right? Anywhere from her being locked to showing the extensive bruising on her body. And the universal response to seeing these images is a physical jaw drop. Like, people are in shock. And unfortunately, there is zero action that follows. And I think that needs to be changed. And that needs to be changed from the top down. We need to hold those in charge responsible. We need to hold DHS responsible. Most of you, especially everyone who has read Ashley's and Jean's articles, know that these cases vastly end up unsubstantiated. As a result, there are no repercussions, not in licensing, and certainly not in any sort of penalties, because where we stand right now, there are no penalties. Legislatively, we're trying to push the bills, the Senator Vitale's group home safety bills, which are not perfect, but at least they do call for financial penalties. And so I'm here to challenge the idea that, there is a white paper that was published almost 6 years ago, and there were wonderful recommendations made in that white paper. 6 years ago is longer than my daughter's abuse happened, right? So if the recommendations were acted on back then perhaps she wouldn't have gotten hurt, excuse me. And so lastly, I see my time is up. I just would like to offer myself. I am here to help. I would love to fix this, So if anybody would like to hear more about our case, my name is Yana Mermel. My email address is yanamermel@yahoo.com. As I mentioned, I am on the council. I think we need to unite and be heard and be seen. Thank you.
Hi, everybody. I think I'm next. So I don't think anybody's called the names. Anyway, my name is Paul Kemka. Thank you for all being here. Thank you, Mercedes, for doing this. I actually just want to, go back to this white paper reference. There are recommendations, and I don't know, as a government agency, are we tracking which of these recommendations have been achieved, which haven't been achieved? I think the other understanding that is definitely not clear. I work as a parent advocate, and I also am with the National Council for Severe Autism. We have so many stories of abuse and neglect, but what I don't know is, what is the charge and who is in charge? When a parent is reaching out to, say, DRNJ or NJCDD. Are we thinking about changes at the legislative level, or are we actually looking at changes within the systems that exist already? Because one thing that is not clear to me is, again, this paper came out 2019, and there are some great recommendations. I really applaud you all for putting all of that together. But what is not clear to me is how far along we are, where have we gotten with this, and who's responsible for making sure that some of these changes are happening. Again, things like DSP training. I know that more modules have been added, more sophisticated trainings have been added, more things are added. Clearly, that is not working. So just adding more modules, is that enough? Do we need hands-on training? I know there are DSP programs, but not all DSPs are going to access those programs. So for a complex case like Susan's child, for example, there should be somebody who actually has physical in-person training. Are we answering these questions? For Bonnie's case, I don't think any kind of online training can bring in that customer service value. So I really want us as a group, as this group, we are parents, we are the experts. And more and more, as I see Yana, as she has testified, or some of us have testified, the reports are shocking to many of these people. So I want to just make sure that we understand that what our charge is, what we can do, and what we are asking our government to do. It's not just government, it's going to have to be a cohesive method. And whether it's NJCDD, DRNJ, legislators, and the DHS, it's ballooning out to be unclear. We have all of these ideas, but how do we make sure that all of them are being followed? What are our milestones? How do we make sure that we set out goals and we are achieving them? Thank you. Appreciate the time and opportunity to speak.
Thank you, Parul. The next person is Vincent. Oh, you're muted.
I'm sorry, can you hear me now?
Yes.
Sorry about that. My mind is still in the 20th century, But thank you for this opportunity to speak, and my condolences and sympathies. The stories of loss and trauma. That's what really motivated me doing what I've done for the past 40 years. I'm a consultant and an advocate with a focus on investigations and abuse prevention. Prior to that, for 30 years, I worked in our field, 27 of those for the state, almost all of that time as an investigator and then a chief in the investigations unit. So for the past 10 years, I've been conducting investigations and supporting investigative units in the agencies and helping to look at some issues. How do you prevent abuse and neglect, which is the gold standard? There are three issues that really have emerged for me that I think are important. One is the salaries for DSPs. It's interesting. I think it's important, the training, the qualifications, the applicants, to have that professionalism. But when I look at the comparison between what people in the state make in an equivalent salary, the resident living specialists, it's about $60,000 a year on average versus about $40,000 a year for DSPs. So why is that? Why are people in the community doing the same work and that same important work making so much less money than the people in the state facilities? I think that needs to be looked at, and how that money that goes to agencies for salaries is distributed. The second thing that I think is really important are cameras. I really would like to lend my voice to resurrect the bill that was offered in 2022 for cameras in the group homes. And the way the bill, and with the idea that people can opt out of it, but as a rule have those cameras. I can't tell you how many times, and I've worked on investigations, and especially as a consultant now, where something is for the agencies that have cameras, for something that's reported initially is kind of, innocuous, or a fall, or, a behavior, we had to use restraint. And then the investigators or someone is able to look at the cameras and say, wow, okay, that's not even close to what happened. This person there was a restraint because this person was goading the individual, or this injury occurred because this person was punched. And, in the background, there's somebody sleeping on the recliner, and then the other staff member, they've gone missing for 4 hours in the van somewhere. It really scares me, because for the agencies that don't have cameras, the only thing that information ends with whatever was reported on the initial report. And for someone, a home where someone is not able to verbalize and tell anybody what really happened, that's the final word. So I support cameras, and lastly, I support electronic systems for, the MARS. The paper systems need to stay in the 20th century. Electronic systems for records, therapy type systems, medication logs. I think that is where that increases accountability and the ability to look back, and for management to really manage the quality of the importance of maintaining those records. So those are the three things that I feel are really important based on my experience. Thank you.
Thank you, Vincent. Up next, we have Kate DeLuca.
Hi, everybody. I do apologize. I won't be on camera, but I am here to speak today. My husband Jason and I are both co-guardians of his sister Jessica, who is a developmentally disabled adult with Lennox-Gastaut syndrome, which is a severe form of epilepsy. Additionally, I also wanted to. I'm not going to talk very much about her background. If you are interested in that, I had spoken a lot about our situation, both for the New Jersey Council on Developmental Disabilities, their most recent statewide meeting, passing the baton, as well as at the Governor's Roundtable. But to start off, I do need to say that reading through these articles was an excruciatingly hard read. It took me weeks to go through them, but not because I was shocked, because everything was intensely familiar. And I could really relate and empathize, although, we are fortunate to not have lost Jessica. Jess has been with two of the providers that were specifically highlighted within those articles. And we were even familiar with some of the stories that were told prior to publication, even so much as personally knowing a few of the people whose stories were told. And there has always been for us this sense of dread that we cannot keep her safe. What is going to be the thing that we will miss? Despite being active and present, what is it that we're going to miss? Jessica's history has included a lot of things. We have been through sexual assault. We have been through abuse and neglect. We have seen a lot of the things that are being talked about in the articles. And what I want to say is my reaction to that, I want to share what I'm seeing in terms of common themes and some things that I think can help. So a lot of times we are seeing the default as I don't know. It seems as though both from leadership and for people physically in the home, the DSPs, if you say you don't know, there's nothing to that. There's nothing more that you could do. And it is intensely frustrating. When we were asking about things about, why is there a handprint in the shape of a bruise on her upper arm? I'm sorry, why is there a bruise in the shape of a handprint? I don't know. Where are her personal items? I don't know. Why is this happening? I don't know. And this has been across the board. Poor communication has also been an issue in terms of just trying to get basic information. I believe Dottie had shared earlier about access to the MAR. Her current provider is giving us, quite frankly, hell over accessing and viewing her MAR. We're being told that we need to submit a request to DDD in order to view it. We are arguing that this is her medical record, and under HIPAA, like they're blocking portability, essentially. They're blocking us from seeing it. We also have noticed tremendous variability across homes. So there's no such thing, quite honestly, as a good agency. There are good homes. So that also makes things very hard to evaluate because depending on the people in a local environment, the quality of care can change. We're also seeing persistence in leadership not following up with questions. I don't know, sometimes it seems as though there are deliberate misunderstandings. Sometimes it seems as though the challenge is to make us follow up multiple times. Um, Things are punted to the ISP, being said to include things in the ISP, but we're finding that, it's not referred to. We also think that a huge thing is that, I'll wrap up very quickly, managers should not be overseeing multiple homes. There's just no way to do that. And I really want to say, just in my last few seconds, that I really strongly believe in empowerment to DSPs. We have seen phenomenal people. The ball should not roll down to them. If anything, leadership should be cognizant of hiring appropriate people. Thank you.
Thank you, Kate. Up next, we have Lisa Smith.
Hi, I'm Lisa Smith. I'm Support Coordinator Supervisor for Family Care of New Jersey. So I see another end of the group homes because I frequent many of them. So what I have found, biggest issues are there's no oversight from DDD. The group home staff is not trained and the DDD staff is not trained. So if there is an incident or something goes wrong, they don't know what to do. And they're like, they have, no idea. So I'm finding though a lot of the group home managers don't know basic rules. Even for an example, I had someone move into a new group home and the parents came to visit and the group home manager said, you can't come see your child. So I called her up and I said, you can't do that. She says she has to make an appointment with me. I said, oh no, she doesn't. They're calling you. They're not being rude. They're letting you know they're coming. I said, they can come whenever they want, but it's basic rules people are not aware of. She was unaware of, I'm looking at my notes here. Well, actually, what they used to do, though, before they switched to the fee-for-service model, they had case managers that would actually come to the homes and actually come in, check the medications, and actually even count the pills to see if they were skipping doses. And they're not doing any of that anymore. They would check the notes to see if they're taking them out in the community. So I'm finding, like I said, most group home managers don't even have any idea what they're responsible for. And that's the huge problem. And what happens now is support coordinators, we write a monthly report, of what we saw, whether or not they went out, but nobody really looks at it. The only time they look at it is if you're audited. And again, if there's an incident, we write an incident report. And what I found in most cases, nothing is done. I had a friend of mine who happens to be a field officer for a day program. New day program opens. He goes in to do his, inspection. They have absolutely no notes, no attendance records, no nothing. He goes back to the supervisor at DDD, says, what am I supposed to do? He said, just tell him to make up notes and we'll come back in 6 months. So DDD is not doing their job. What else? Oh, but I also would, I had another incident where I had a consumer that moved into a behavioral home. We get there and he had transitioning issues. So we're like, can you get the behaviorist in? There was no behaviorist. So they're getting paid double the amount because he's supposed to be either getting 2-to-1 support and have a behavioral staff, but there was no behaviorist. It went on and they never told us this boy sat in the house every day for months, never took him out because the staff was afraid of him. So I think an important thing that we need is behavioral techs on staff at these group homes. They're getting paid a lot of money. I don't know why they're not hiring behavioral techs. It just seems they just hire anyone. And you need nurses to oversee the programs. So this boy ended up, it took about 9 months. We actually said enough, you need to get a behaviorist in there. This is not acceptable. We got DDD involved and eventually they did get a behavioral, but it took 9 months. So they are getting paid double to have this behaviorist, but they're not being, no one asked them to reimburse the state because they didn't provide the service. So I do think fines are really important too, to getting people to comply. And then also the same boy, he ended up during this time frame, he lost 50 pounds. Nobody told us. We called every month, did a monthly monitoring. He lost 50 pounds. They were taking him to the doctor. And in the end, it turned out that this boy ended up having kidney failure. The nurse came in. At one point, they finally sent a nurse in after 6 months. She had him sent to the hospital, or else he probably would have died. He ended up in the hospital for 2 months. So I think it's important, behavioral techs, more oversight, DDD. Someone needs to go in and start checking from DDD. I know they have field officers that come in, but honestly, I've been in business 7 years and I have 95 clients. If I've had 5 field office visitors in 7 years, that's it. So there's definitely not enough oversight with DDD. And again, when there's an incident, no one seems to do anything. So DDD is, just as responsible. Let's see.
Harry, you have a written
That's it, thanks.
testimony? Oh, I'm sorry, Lisa. Did I interrupt? Were you?
No, that's okay. I'm good. I think I'm done.
Okay.
I mean, I could go on and on. I have a bunch of stories here, but
Okay. Well, can you share them later with because I think what we really need to do is have a really good record of a broad record. So if you have a minute, please share that. But Carrie, you have written testimony to share?
Yes, so we received written testimony, but the individual asked to remain anonymous. So Mercedes Witowski is going to read the written testimony.
Thank you. So this individual submitted testimony as a concerned and committed family member of an individual with significant disabilities who lives in a group home. This person has witnessed far too many situations that could result in serious injury or even death, and are here to raise urgent concerns and ask critical questions on behalf of families like hers or his. First is lack of transparency after incidents. When an incident occurs and is investigated, families are often told it is unsubstantiated, even when clear evidence exists that something did happen. That there's frequency in being assured that the agency will follow up, yet the person said they can provide multiple examples of where this has not been true. Second is oversight to prevent provider cover-ups. Question what specific procedures are in place within the system to verify that providers are not covering up incidents, what independent checks exist to confirm the accuracy of incident reports, and again, person can point to multiple examples where accuracy and transparency are not delivered. Number 3, staffing ratios and emergency preparedness. How are staff to individual ratios determined and what factors are considered when assessing an individual's support needs? This person's been told there's 1 staff person for 3 individuals, but in the event of a fire emergency, this person knows firsthand that his family member with disabilities will not exit the building without physical assistance, claims that drills are conducted and that the loved one is capable of doing X, Y, and Z, and it's simply not consistent with reality. Number 4, training of temporary staff. When agencies rely on temporary staffing, what safeguards ensure that these individuals are properly trained? Referring to an individual's individualized service plan is not sufficient. This person has encountered temps and even regular staff who could not answer basic questions about their loved one with a disability. Number 5, negligence in basic care and medication safety. Of repeated complaints from families about hygiene, processed food, unqualified staff administering medication often go unaddressed. This family member was once given another resident's medication, which resulted in life-threatening emergency and hospitalization. The manager didn't even know which hospital they'd been taken to. In another incident, staff were unaware of the family member's medical conditions and could not communicate them to emergency personnel. No medication binder was available to ensure coordinated care. Number 6, food budgeting and nutritional oversight. How are our loved ones' food allowance being used? Staff purchase junk food like soda, chips, chalk cookies, to name a few, under the excuse of the other clients eat this stuff. Yet families have confirmed they do not want their loved ones eating this either way. Staff eats these items while on duty. I spend an additional $65 a week to ensure my family member receives healthy pre-cooked dinners. There's no staff cooking, just microwave processed foods. Where's the oversight and accountability? The 7th area is division monitoring and visit protocols. How frequently does the Division of Developmental Disabilities conduct monitoring visits? Are they scheduled or unannounced? I've heard that low staffing has led to periodic pre-scheduled visits. There needs to be serious change and accountability with the agencies that are out there. Too many things are being covered up, and I could give more examples of incidents that have taken place. Families have no one to help us. That's how the majority of us feel. We're scared and we need real change. Not lip service, not more boxes being checked, not another, we're working on it. The system is broken and it needs to be fixed. I'm willing to do whatever it needs. I need to be part of this change. This is not an attack. This is a cry for help so that my loved ones, like others, have the opportunity of a quality life that they deserve. Families should not feel should be able to feel secure and at peace that their loved ones are being cared for, not just babysitting by unqualified staff who know nothing about special needs or even those or what disabilities are. I was told that they're trained, and I've come across staff who could not even read. I pray this conversation leads to meaningful changes.
Thank you, Mercedes. If you registered to speak or emailed us after you registered, identifying that you want to speak, and you do not see your name on the list, please check your private messages. I emailed or messaged two people just to get confirmation about whether or not you're still comfortable to speak. And with that, our next person to speak is Michael.
Yes, hi, Mike Sullivan. I'm a parent of a child in a group home. I'm also part of the National Council of Severe Autism. My son is 27. He's nonverbal, requires 24/7 care. He can't change his clothes. He is in diapers. Sorry, my phone's going to sleep. And he's been in a group home for 2 years and in a day program since he's 27, so 6 years. Fortunately, the home is less than 20 minutes from my wife and my home, so we're able to visit several times a week. He's quiet. He has no behaviors, but he needs assistance with basically everything. With our involvement, because we are able to visit so often, we often find neglect and mistakes that only we find. Most of the time, it's lack of general health checks or oversight. Some of the time it's just not reported when we visit and the home or the staff tells us, or we find out much later. Most of the health concerns are around medication, illness, and home temperature. Medication, because we went on vacation a short time ago and we got the MAR, we discovered it was missing a medication that hadn't been taken for 7 months. We did some investigation with the group home manager and found out that due to a phone call from the home that they accidentally removed it from the MAR, but they shouldn't have done that. We also found out from the group home manager, we have a new group home manager, so she's telling us things that were lapses from the previous one. There were extra doses of some of his over-the-counter stuff in the cabinet. So we kind of, wondered, was he not getting it when it was even on the MAR? One medication was stopped that shouldn't have been, it wasn't, they stopped giving it, but sorry, I got this backwards. They were giving it, but they shouldn't have been giving it. The other thing on the health spectrum was often, something's going on with the injury or or health that is not noticed and not called. Sometimes he's prone to bloody noses. He actually had pneumonia and they weren't reporting that he was coughing. We only have him, some of the time on the weekends, so we were noticing that, but not as much as the people that see him every day. The house temperature last summer, we visited, and it was in the middle of the summer, and it was 90 something degrees out, and air conditioner wasn't even coming on. And so they ended up, because of our visit and us reporting it, vacating the house, which, I think the staff just didn't report it. Because of those incidences, I actually installed a temperature stick that I can monitor from my phone and see how the house temperature is. But often, our fear is we're not there. We don't notice, something going on. And we found out much later because he can't tell us. So that's my story. I guess I'll use my last few seconds just to say, so many of this laundry list of things that people mentioned, I could put on my list, but it's just, so many things are familiar. And I think, as probably some parent would say, our biggest fear is when we're not around to check on these things. So that's my time. Thank you.
Thank you, Michael. Up next, we have Kathy Tamburello.
Good afternoon, everybody. I'm Kathy Tamburello. I'm the co-chair of the Regional Family Support Planning Council. I also am mom to Michael, who is in a group home through YCS. And I'm a retired school administrator running a middle and high school for children with autism. Michael came through Avaserve, and as we know, Avaserve no longer exists. They lost their license. And I think one of the big issues that came up with Adviserve was a continual revolving door of staff and just quick hires, getting them in there, and not knowing the residents and not attempting to know them. I think what I've learned as the school administrator in the school that I worked for, that it all came down to the staff that was working with the children directly, the teachers and the teacher assistants. And in order to have strong staff in a classroom, you needed to have a culture in the building that supported a philosophy that everyone agreed on. We came with the same understandings of what we wanted to achieve and how this school should be run. The challenge with a group home is that they become an island. And that certainly is one of the concerns in my son's group home. I think that, he's in a home with three other gentlemen, and the home is a little bit off-site from where the bulk of the group homes are. And I have to say about his group home, we've been very lucky. He had consistent and excellent staff all through the pandemic. I think that staff need to feel that they are connected and that they have someone to go to, that they are supported, that when challenges happen, they feel comfortable bringing those challenges forward. And I think that's where a lot of group homes, there are many issues to discuss today, but I think that's one of the issues that has to be addressed. I think you need a strong group home manager who starts with a set of givens, that these are people that we are taking a person-centered approach. We're getting to know our individuals, and we're building a home that is based on who they are, what they want, and that they have the immediate support if there are challenges that come up. So I think, certainly, I think it was Vincent who said, we also need to pay these people. This is hard work. They are not only responsible for the care of the individuals, they're responsible for the house. They do the laundry, they clean the house, they cook the meals, they shop. It's a hard job. And I think we have to compensate people and make them feel valued. There are many people that take on this work because they're committed to it and they love it. But they're struggling to feed their families and they're working 2 and 3 jobs just to make ends meet. So I think that is definitely one of the things that, among many, that have to be addressed. But I feel it's so important for the staff in my son's group home that they feel valued and supported. So thank you.
Thank you, Kathy. Up next, we have Laura Kelly.
Hi, everybody. So my name is Laura Kelly. My daughter is 36 years old. Alexa, her name is, and Alexa has profound intellectual disability. She also is very medically complicated, and she has significant behavior issues, the trifecta, as we like to call it. So Alexa has lived in a variety of settings. She lived in a private residential setting out of state. She lived in a group home for 22 months run by Community Options, which was mentioned often. It was a nightmare. They put her into the ICU twice and eventually evicted her, which probably saved her life. And she currently now lives in her own apartment in self-direction. And we're overseeing it, and it's really, really hard. But anyhow, so she too, everything we've all discussed, she's experienced. It was really, the group home was horrible. Community Options, when she left in 2016, when she was evicted, they had about 103, 104 group homes, and they now have 125. So in those years, they've had 20 plus more homes approved. So what can we do? Legislation can be helpful, but as we all know, it takes forever to get a bill across the threshold. And a lot of times agencies don't even pay attention to the bill once they've been enacted in law. And why is that? Because there's no accountability and they know they can get away with this. And so they do it, right? So they do it. They hire people that are not competent, that are not trained, have the least amount of skills you could possibly, can't cook. I would say many of them probably don't even read at a 12th grade level and trying to interpret doctor's orders. So recently, as of last week, I met with the Truth Commission. The Truth Commission is something that's been developed by our Attorney General, Matt Platkin. I wanted to make sure that they were aware of the articles, the Hidden at Home articles. He said he was. I don't know if the other people on the commission were aware of it. And then they had me meet with somebody from the Division of Criminal Justice. So I serve as chair for Camden and Burlington counties. And I think a route that maybe we could pursue is if we could get this trust commission to meet with us and let them understand the urgency. And if they could create some kind of, the agencies investigate themselves. If it's a pretty significant thing, it gets turned over to DHS. They have the ability to turn it over to the Attorney General's office, but they don't. My daughter was in this group home for 22 months. She had like maybe 25, 26 UIRs with 23 of them being substantiated. Didn't make any difference. So if they could create something, I know there's been talk with this urgency and now paper about the New York Justice Department. They have a justicing that oversees this, which could be very helpful. But, the big, beautiful bill that's coming through, the state's going to be $2.5 billion short. So I can't see them implementing something like that. But if we could get the Attorney General's office to take this a bit more serious, then maybe agencies will realize that somebody now is looking over their shoulders and they can be held criminally liable. And maybe they'll step it up. So that's my thought on the matter. Thanks all for it.
Thank you, Laura. Up next, we have Kathleen Freeman.
Yeah, hi, Carrie. Hi. I just wanted to say I have a son who has been in a group home for 16 years now, severe autistic, profound, but I've also been involved with these groups for a very long time. I've been on the Family Advisory Committee for DDD. I've been chair of Region 7 for the Regional Family Planning Councils. I'm in the clinical advisory of the National Council of Severe Autism. I was on the subcommittee for the white paper. I was on the subcommittee for the Kimonos inspections. I have testified for the statewide transition plan, and I've done things that anytime Lisa Parles usually asks me. We're all talking about the independent oversight with independent oversight, which could develop with real consequences to improve quality care. hold on. And as far as, the professionals know, and in literature, professionals such as the RNs, the BCBAs, the National Associations of DSPs, they know what is good best practice. I don't know why stakeholders, it seems to come up all the time, but we need to come up with best practices. It's out there. The professionals know how to do it. Our advocacy groups really have not been able to generate a response, whether it's the white paper from 2019, as we said, that's 6 years, or they haven't advocated for legislation that really helps this population, whether it be cameras, the bill on medications as far as A5416, medication age. And quite frankly, since I've been involved for so long, I'm kind of tired about hearing why providers or the state just can't do this. So why do we accept the suffering, pain, and basically homicide that occurs in our group homes? It's homicide without any fear of punishment, jail, as Laura pointed out, as far as the Attorney General. And honestly, this is fraudulent use of monies to provide services, which Paul Aronson has spoken about as far as follow the money. They still get the money when they're even understaffed. So to me, it's fraudulent use of Medicaid dollars. And that's all I really have to say. Because you know what? I appreciate everyone's comments. You're spot on. All these problems exist. And because I've been involved for so many years, quite frankly, we need to do something. And I'm really tired because we haven't been able to change behaviors by these providers.
Thank you, Kathleen. If anyone else, there's 2 more speakers lined up at the moment. If anyone else would like to be added to the list, please share your name in the chat. Up next, we have Pat Miller.
Hi, I'm Pat Miller, and I have a son who's 24 years old with severe autism. He currently lives at home, but I'm speaking on behalf of the hundreds of families who are part of the National Council for Severe Autism New Jersey chapter. We are united in advocating for state-level policy to change and protect individuals affected by severe autism. Thank you for giving us the opportunity to participate in this virtual conversation centered on ensured safety and promoting thriving in licensed care settings. We appreciated the chance to review the white paper initiatives. Just to give you some background on myself, I have over 30 years in healthcare, specifically in operations and process improvement. I commend your efforts on conducting these listening sessions, and I encourage the stakeholders to be given this platform to respond to Hidden at Home in this investigational series. As a parent, when I read those articles, I felt devastated, and the fear just increased astronomical levels that all of us on this call feel like we can never die. I would like to highlight several key concerns and requests. Many families come to me and there is a deep fear of retaliation when offering feedback. It's based on actual experiences, and we urge that this group cultivate an environment where families are true partners in care and empowered to give honest feedback without the fear of consequences. As Dorothy mentioned early on in this call, open, honest communication builds trust. And that trust is the huge and the biggest component of improving healthcare initiatives and outcomes. From an operational standpoint, these white papers give great goals and initiatives, but what I don't see is a standardized process, measurable goals, timeframes, and data. There's huge variability, as we heard from Lisa, from Kate, from Dorothy, from Kathy. Okay, there is a vulnerability here because we can't rely on the few good people or the few good providers or the good house, right? What we need to rely is on a system, a good system that continues to work when the family's not around, when the good people aren't around, when they leave, when they get married, when they can't afford to be a DSP any longer. We need to really focus our efforts on process improvements that are based on systems. And so is there data that can be shared with families that demonstrate that what you're working on right now and have been working on since 2019 indeed met the goals of preventing illness and injury, abuse, neglect, exploitation, deaths, as well as improving the partnership between the provider and individual family relationships through transparency and collaboration, because that's really what we need. We need this data for the critical use of advocating for meaningful change. When we go to legislators and we go to policymakers, that is the data that speaks volumes. That is what is going to change and create the environment that we all need. We are pleased to know that one of our members now serves on the Health and Wellness Subcommittee. We're hopeful that representation will ensure the voices of the most vulnerable and that they're heard and acted upon. We respectfully request ongoing collaboration with these initiatives. The New Jersey chapter has created very specific recommendations that include those kinds of systems, those kinds of processes with timeframes and actual measurable outcomes. We hope to work together to be able to implement a standardized, comprehensive manner with clear metrics and timelines. So we have a shared commitment. We hope to be part of the solution, and we look forward to working together.
Thank you, Pat. Up next, we have Laura.
Hi. So I'm a parent. I actually also sit on the board of Arc of Morris, where my son is currently in a group home, and I sit as a family council for the New Jersey Council for Developmental Disabilities. So, my son is 24. I've been an advocate a long time for him and others. When my son first turned 21, he did move into a group home due to some family situations where he could no longer remain home. It was a provider who, unfortunately, he moved out during COVID, and we couldn't interview quite a bit. Like, we had a lot of phone calls, but not a lot of in-person meetings. And so they promised a lot and did not deliver. He was in a medical group home due to his a rare genetic syndrome that causes a lot of medical complexities. We had a great deal of issues, and I won't go through all of them, but things like he has food allergies. Oftentimes when they had staff turnover at a manager or director level, they wouldn't order, gluten-free foods for him. So he would end up eating regular foods like pasta dishes that were not gluten-free and end up in the hospital with hives. He has walking trouble. He wears a brace, and he's not supposed to go up and down the stairs without an aide being present next to him. But they would let him go to his room, it was an older home and was grandfathered with steps. So he would have to go up steps to go to his room, but no one would go with him. So multiple times he fell down the stairs, resulting in, major amount of bruises, thankfully no broken bones, but quite a lot of injuries. And again, he was under close observation. So he was supposed to be eyes on at all times. And if he was walking around the floor or walking amongst different floors, then somebody would have to go with him. And there were times where I would bring him home and staff would be out with some other members of the house, and there was literally nobody there to receive him. And they're like, well, you can leave him. The staff will be home soon. And I'll be like, I can't leave him by himself. He needs to be supervised. And I'd have to wait there sometimes for hours on a weekend, waiting for the short-handed staff to show up. We had nearly weekly meetings with management. And really what we found the most was that staff were poorly trained, they were under-resourced, and it was really tone at the top for us that made a huge difference. His previous agency, they were there for the income, and they weren't necessarily there to provide a quality living arrangement. And they would promise to make changes. That was frequently not the case. I will say, after 2 years, we moved him out, and he is now, as I said, in an Arc of Morris house, where we've had a vastly different experience. So I will say, the realities can be different, really, depending on the agency and depending on the house, which is, as you say, unfortunate. But he's in a good place where he's provided a one-on-one level of care, 24/7 during medical crises and during certain situations. And it has been a much more positive experience. He's really well cared for, and I'm very comfortable with where he is. But it's unfortunate that parents coming into the system there's no way to evaluate for that. It's just luck, and that's the problem. Our kids deserve, to be safe and happy at home, and that's really all we want for them. Thank you.
Thank you, Laura. Up next, we have A. Gianna Tiempo. I'm sorry if I butchered your name.
Hi, good evening. That's where we're all at. Hold on a second, please. Okay. Hi, everyone. I've been listening to everybody's stories. I'm the one who wrote the testimony, and at first was hesitant to put my name out there. But after hearing everyone's story, and my heart goes out to all of you who's experienced so much pain and hurt, I'm very sorry for that. We are in a situation, I just came across an article from the statewide family support coordinator that was written, that I helped write back in 2002 with the same issues. And we're in 2025 and these situations are still occurring. And it's to the point where I'm tired of hearing all the protocols that are in place and nobody, the change needs to happen. So I'm just putting it out there. I'm going to be one of those people that help try to make that happen, whatever that is, meetings, writing, going to legislate, doing whatever I have to do, because even since 2002, all these issues have been happening. And I firsthand, I'm my brother's legal guardian, and my heart is screaming for help. So I just want to put it out there that we all have to work together and try to make these changes once and for all before more tragedies continue to happen. Thank you.
Thank you. Up next, we have John Brewer.
How do I do it?
Good afternoon. I'm afraid I cannot stay very long for reasons that will become evident. I'm the chair of Council 3 and have been actively involved with the IDD community for many years. Our daughter, now 37, lives at home with us, and my wife and I are her primary, essentially her exclusive caregivers. We have begun the search for a long-term residential solution for her. And what I am learning is I have never felt entirely comfortable with a group home setting for her because she has medical needs that I'm not sure could be reliably and predictably addressed in a group home environment. Group homes are, of course, harder to staff. They have a smaller ratio of staff to residents. As we began looking for, a couple of years ago, I first encountered the issue around HCBS because Nicola had previously attended respite care at Eastern Christian Children's Retreat several times, and we found that to be a very, very satisfactory experience. I don't know how many of you know about ECCR. It's way up in North Jersey. It changed its name recently, and I've now forgotten what the new one is. But as we began looking for a permanent residential solution for Nicola, I've been encountering some difficulties, some resistance. For example, ECCR, the last time we tried to place her in respite there, they were disqualified from DDD for respite care because they're an institution. So we had to make an alternative arrangement, which happily we were able to do kind of at the last minute. We've looked at Spectrum. We intend to look at a couple of other institutional residences. And what I hear from all of the other families I speak to, and my own sense, is that the Olmsted message, which is absolutely unexceptional to the extent that people who wish to live in a community setting should have the opportunity to do so, it has been interpreted now in such a way that it restricts choice rather than expanding choice. That people like my wife and I, who might prefer an institutional setting for our daughter for whatever reasons, are, if not actually prevented from seeking such a solution, certainly discouraged from doing so. When I asked our support coordinator at the start of this process to give me a sort of an agenda of what kinds of housing choices are available, she told me about group homes, medical group homes, supervised apartments, self-directed supports in a private home, not a word about institutions. By way of illustration, my daughter, who has fairly complex and profound disabilities, is specifically she has chronic constipation and chronic UTIs. Neither of those things sounds particularly glamorous or medically challenging, but if they are not monitored carefully and treated in a timely way, they can become fatal. In fact, they are two of the key members of the Fatal Five, as I learned. Yesterday, my wife and I drove back from a visit to my brother in Massachusetts. We went to a family reunion. We noticed that Nicola was feeling unwell and sort of panting and gasping in a way we had not seen before. After a couple of hours of trying to relieve her circumstances, we finally decided that we needed to take her to JFK to the ER, at least for an evaluation. As it turns out, she had attempted to pass a kidney stone. It was blocked. She got an infection, and apparently the medical consequences of this could be extremely, extremely severe. She's now in the ICU at JFK, being supported so that her blood pressure can be restored, and then eventually she can be treated for the infection. I'm not a medical expert, but I could so easily see how someone else would look at Nicola in those circumstances and say, she'll be okay in the morning. Well, as it turns out, if we had waited, she might not have been. I would strongly urge DDD and any other organizations that are involved to open up the scope of choice for families to include institutions of various kinds, so that people really do have flexibility and a range of choice instead of being channeled into 2 or 3 structures which may not be appropriate for that particular individual. I emphasize, I have not had any conversations with DDD. They have not told me we can't do what we want to do. It's simply that other people who have been involved in this process have warned me that this will face a fair amount of resistance. And I'm hoping that if we encounter that resistance, we'll overcome it and find a good place for Nicola for the rest of her life, because that's what she needs and that's what we want. I apologize for taking your time, and I'm sure you all can appreciate that I have other quite pressing needs. So I will go back to see my daughter and wish you all the best for the remainder of your conversation. Thank you very much for your time.
Thank you, John. Next we have Nellie.
My daughter spent 9 months in a supervised apartment, brand new apartment, beautiful apartments. We were promised that there were going to be a nurse in the building at all times. Managers were going to be there 24/7. It was 3 managers for the 6 apartments times 4 individuals in each apartment. But not much was done. One of the things that I think should happen, because I noticed that there are more and more supervised apartments that are handled by one agency alone in the same building. I think we should suggest that they should have nurses, like a standard nurse for the whole building, because they only come to take care of the medications and that's it. That's not fair. Also, I noticed, yes, because it was a new residence, DDD did come during the 9 months, did come to see the place. See the place. No, they came to look at the books. They do not look at the apartments. They don't bother to do anything. And what is more, they come announce, oh, everything is nice and dandy in case they come. That's not right. Also, I think we should insist that the DSPs and the managers read the ISPs for each client. Every time that you change the DSP, the DSP should read these ISPs. After my daughter was there for 7 months, I realized that they were not doing what the ISP was indicating. And I think that's one of the things that Bonnie mentioned about her daughter and her hands. That should not be happening. Also, in their place, they were required to write extensively what happened during the day. But when a DSP comes in to change the shift, they don't read what is happening. So what good is that to have it in paper if the new DSP comes and they don't follow it? Also, I think, yes, the DSPs need to get paid well, but I think they should have more incentives for them. One example is one of the DSPs that was taking care of my daughter was docked because she was 10 minutes late. And she was telling me, with 2 docks, they fire me. No, that's not the way they should handle them. They're humans. They have problems. They should think about other ways of making them feel pleasant at their job and holding their jobs. Another thing is my daughter was hospitalized, and I called and I told them she's in the hospital, she has pneumonia, she has colitis. I will let you know how everything is. For 5 days, nobody from the agency called to find out is she alive, what happened, nothing. Another thing, emergency preparedness. They had fire drills constantly. They were on the 3rd floor. They woke up the individuals, they took them out to the hall. Okay, how are they going to work? What is going to happen when they have a true emergency that they have to go steps down with handicapped people that cannot move fast enough or cannot use the stairs? That's not emergency preparedness. I think there should be some kind of a site where us as parents should review the agencies, tell it how it is, so either they shape up or they get out. I know that there will be cases where people complain about small little things, but if they are better, if they're working well, they will get also positive reviews. Thank you.
Thank you, Nellie. Dottie, you wanted to share two
Yeah, I
stories?
just have one story actually, because thankfully John Brewer was able to make it despite the emergency that his family is going through right now. An anonymous story. A friend had her son placed in a group home, and she thought it'd be wonderful because it was right in the middle of town. They had access to Access Link, all sorts of things. Unfortunately, one person in the home should not have been placed in any sort of group environment. Behavioral, did sleep, and the other 3 roommates suffered. And that situation continued for almost a year. I'm bringing it up because it's just another facet of group home living that people should be aware of and the state should be aware of, because when something like that happens, the state should be able to amend that situation quicker than a year. That's all I wanted to say. Okay.
Thank you, Dottie. As for the last person I have registered, if anyone else would like to speak again, just put your name in the chat. We have Morgan Miller.
Hi. So I apologize. I came in a little late to the meeting. I had a doctor's appointment, so I missed a lot of people speaking, and I apologize for that. But I have been listening for a while now, and I work as a direct support professional in a group home right now. I've been working for about 2-ish years now. Well, no, more than 2 years. 2 years with the current company. I think another year with the other one. Regardless. Sorry, I didn't have anything written beforehand. Um, Hold on, I had some notes. Give me 1 second. I will say that, and I'm not trying to say this is like empty platitudes or something like that. and I'm not trying to give like false hope. I'm just trying to give some reassurance that there are DSPs, and I'm sure all of you know there are DSPs that are truly trying their best and doing what they can to really help the individuals that we care for. There are definitely, as all of you know, a lot of issues that do need to be worked on. And I will say that I've encountered a fair share of, for lack of a better phrase, and I'm trying to word things very carefully, I've encountered very interesting things over the past couple of years that have happened. I guess I could say I would have loved to speak earlier on, because what I would have said is, to the parents here as DSPs, what would you like us to do more? Like, what can we do more to best help the guardians, the individuals from a parent perspective? I with the company I work with now, I had a good amount of not constant contact, but also with frequent contact with the guardian, which, in at least my opinion, I think actually helped me care for that individual I was with even better. And I would hope that, DSPs in general would be more inclined to communicate more openly with the guardians and the parents, and understand that, what I always tell my coworkers is, we're not, it's not just a job. Like, it is a job, but it's not just a job. We're working in their homes. We're working with them. Our job is to truly provide care and support and protection for the individuals, to help advocate for what their needs are, regardless of how we feel about most things. I remember, I think it was, I forgot the name already, and I apologize, but they were talking about how they believe that DSPs should read the ISPs of the individuals when they move from home to home. First, I will say I personally do that. But there, as my father has once said in the past, you will always have people who do their jobs, but you will always have people that don't. And I don't know. There are DSPs that truly do care, and we are trying our best, and we are limited in certain ways. And I wish there was more opportunity for us to be less limited, to help more, to have more interaction with not just guardians, but more direct input on, the ISPs themselves, the IDT meetings, things like that, because we work with the individuals, sometimes even one to one, and we're with them. Some people work even more than I do, but I'm with the guys I work with 40 hours a week, and we see them, and we at least, I can only speak for myself, but I at least want to help. I want to do more. I apologize if I'm missing anything in the chat. I minimized. Give me 1 second, because there's 5 messages. Thank you so much for taking this. Yes, there are a lot of us that are trying to do 24/7 staffing and nursing support of the developers and the $25. Okay. My apologies, but there are issues that there are people that are trying to fix and work on and do better. And I can tell you right now, I know, at least with the company that I work for currently, I'm not going to say it's perfect, but it is good, and there are a lot of truly kind people in it that are trying to do the best they can with everything going on. And with everything going on with current, like, bills and Medicaid bills and things like that, I can only imagine how complicated things are higher up. You're welcome, Crystal. That's really it. But I know there's not much else, but I think that what could be good is, there are other DSPs that are like me, that want to be involved in chats and in video discussions like this, and audio discussions, that want to be able to do more. And we want to have the opportunity. Like, my wife is an assistant manager. She was just asking me, how can we know more about these kind of chats, about these kind of conversations? Because we want to be involved, and we want to do our jobs better, to truly improve the lives of our individuals. And if there could be ways for DSPs and managers and people that are working on the ground to be more involved in that, that would be beneficial on our end too. Because I only know about this kind of chat through the National Council of Severe Autism, which I've been communicating in their WhatsApp group for a while now. But if it wasn't for that, I would have had no idea.
Yeah.
Um,
Morgan, I really appreciate you joining us because I think we're all here because we want to fix the system. Clearly,
yes.
you all have very clear stories. You've made excellent points. It's been really enlightening. I think we have to figure out a way forward to figure out what we can do to fix this. So, should I turn this over to Mercedes or Paul? How do you want to wrap this up?
Sure, I'll start and then I'll turn to Paul. Thanks, Dottie. Clearly, we could talk and talk and talk, and for the people that didn't make it here because they didn't know about this opportunity, we hope that they find an opportunity, if not through us, but through other organizations, other support systems that they associate with, because this is not a simple conversation that has a quick fix. It is a multi-step approach. Changing systems, unfortunately, does not happen as quickly as we would like it to, and at the same time, lives are impacted every single day. Um, there are many advocates who uh, can articulate what needs to be done, but I think that the conversation, at least at the New Jersey Council on Developmental Disabilities and its committees, as well as the Regional Family Support Planning Council and its committees and our ombudsman, these conversations have focused on what can we learn from listening. How do we continue a conversation that informs us while at the same time looking for opportunities to create the system's change and the capacity in the system to address individuals and assist individuals across the gamut. So I'm going to ask Carrie to just reshare the slide that we started with a little bit earlier in the conversation. And we had some things that we had already kind of placed on this slide in terms of I'm calling them buckets, areas that need attention and need system, a look at the systems and how the improvements, or these are not the improvements, but the areas that need improvement. So we had the blue items were already on the screen and they were edited as we listened today. There are additional items that were added. They're in green and there's a second page, but before we go there, so we added items like transparency and access to information by family and caregivers, emergency preparedness. We added audit, inspections, monitoring on health, well-being, and quality of life. We added system design to support individuals' needs, like the community care program, nursing and nursing supports. We added state provider accountability, responsibility, and adherence to policies and requirements. We added tracking of recommendations with results, staffing that's consistent with individuals' needs, i.e. nurses, behaviorists, and also staff ratios. Carrie, if you could just go to the next slide. And then we added licensing, license settings, the culture within them, DSPs feeling valued and supported, um, trust commissions, the Trust Commission and Attorney General's Office, and Medicaid fraud, waste, and abuse were also mentioned as organizations in the state to help support this work, succession planning, system data that's needed to show if improvements that are being made are working or not working, and the timeliness of those. We added choice of living options, preventative care and protocol, like the Fatal Five, family inspection and oversight and monitoring. I really like that when I heard that. Looking at self-direction to be an effective option and removing rules that limit access. And then bringing all system users, providers, DSPs, support coordinators to the discussion. So one of those, to that point specifically, we would like to look at and continue to understand how we can bring the conversation together, but also bring the expertise of folks like you, who have experience directly in some of these areas to help us work on the solutions at end of it. And we're talking about ways that we can do that. We're certainly open to your suggestion. This was a conversation to start that opportunity, but certainly we're not anywhere near the end. But we have great people here who have not just the experience, but the willingness. And I heard so many people say, I'll do what it takes. I'm ready to participate. So we want to use that opportunity. I also heard a couple of folks mention a white paper that was developed in 2019. And I appreciate your bringing that up. I think someone may have even put it in the chat. What I was disappointed is that we haven't done a good job in communicating the things that have happened as a result of the white paper and the recommendations. And at some point, we're hoping this week, we'd like to put an update to the white paper of the things that have taken place, changes that have been made, input that has gone a long way at the state level, and the recognition that, again, there is so much more work to be done. This is not the end, unfortunately. There hasn't been a magic wand to fix any of this, and with all the recommendations today, even doing everything that we've spoken about, I fear that that still is not enough. So I don't think that we can expect a system to be perfect, but it's the families like you, the advocates, the siblings, the DSPs, the support coordinators, who all have a stake in this, all have the ability to participate in the conversation, that I think collectively can make change and will make change. So those are some of the points that I just wanted to make, and I'm going to go to Paul to close us out.
Great. Thank you, Mercedes. And first of all, I just want to thank you, Mercedes, Kyoko, Carrie, Kathy, and Dottie for helping organize today's conversation. Great colleagues, great partners. Thank everybody here who came, all 81 of us who are here, but particularly, obviously, those that shared their stories. We know it's difficult. This is a difficult conversation, but it's a very necessary conversation. We're committed to sort of working with all of you and others throughout the community to move it forward, to bring about real results. We're putting the final touches on our annual report, our 2024 annual report, which I hope to get out the door at the end of this week or early next week. But unfortunately, once again, among the issues we're highlighting is abuse and neglect. It's an issue that we've discussed in most of our annual reports because, frankly, again, it's an issue that we deal with on a daily basis in our office. It's very real. It's very serious. It's very disturbing. But one of the things, I note in the report, I noted this recently in an op-ed I wrote, the work we do, all of us, in whatever capacity, as a family member, as somebody who's in government, direct support professionals, educators, it's hard. This is not easy work, right? But none of this is rocket science. And we know that eliminating abuse and neglect is something we can and should do. It's real simple. It's real straightforward. from our perspective, we talk about the workforce, and as we talked about earlier, about training, about compensating, about holding people to higher standards, accountability of the provider agencies and of government officials involved, and of course, getting that investigation piece right. We know the answers, and so I'm really, looking forward to sort of moving this conversation forward in the remaining months that I have in this job, working with all of you, because we need to do this. We need to do this. We heard some of the stories today. We hear these stories every day. It's tragic, but it's preventable. And again, I just am so grateful for the partnerships we have with our organizations and with all of you. And again, we're going to come back to you soon with some ideas based on this conversation and based on the input that we'll probably be getting after today's meeting. So thank you, everybody, for moving this forward. Thank you. I guess that's it.